लैम्प टिश्यू फ्यूल्ड होता है लैम्प. As the blood passes through the capillaries in the tissue, some water along with many small water soluble substance move out into the space between the cell of the tissue. हाँ, कहाँ पे space between the cell of the tissue, leaving the large protein and most of the foreign element in the blood vessels. This fluid release out is called the interstitial fluid or tissue fluid. It has the same mineral distribution as that in the plasma. हाँ, टिश्यू फ्लूइड में सेम मिनरल डिस्ट्रीब्यूशन होगा जैसा कि प्लाज्मा में होता है. ओके. एक्सचेंज ऑफ न्यूट्रिशन गैसेस एक्सेट्रा बिटवीन द ब्लड एंड द सेल ऑलवेज अकर थ्रू दिस फ्लूइड. हाँ, एक्सचेंज ऑफ व्हाट? exchange of nutrition gases etc between the blood and the cell is always occur through this fluid. हाँ, an elaborate network of vessel called the lymphatic system. Lymphatic system collect this fluid and drain it back to the major vein. This fluid present in the lymphatic system is called lymph. हाँ, this fluid present in the lymphatic system is called lymph. लैम्प इज अ कलरलेस फ्यूल. लैम्प क्या होता है? कलरलेस फ्यूल होता है. कंटेनिंग स्पेशलाइज्ड लेम्फोसाइट विच आर रिस्पॉन्सिबल फॉर द इम्यून रिस्पॉन्स ऑफ द बॉडी. हाँ, रिस्पॉन्सिबल होता है इम्यून रिस्पॉन्स ऑफ द बॉडी को. लैम्प इज एन इम्पोर्टेंट कैरियर फॉर न्यूट्रिशन एंड हार्मोन. हाँ, लैम्प जो है इंपॉर्टेंट कैरियर किसके लिए? न्यूट्रिशन एंड हार्मोन एक्सेट्रा. फैट्स आर एब्जॉर्ब थ्रू द लैम्प इन द लेटिकल प्रेजेंट इन द इंटेस्टाइनल फ्लूइड. हाँ, fats are absorbed through lamp in the lenticle present in the intestinal villi. Okay. Circulatory pathway. The circulatory pattern are of two types. हाँ, open and closed. Open circulatory system is present in arthropoda, mollusca, in which blood pumped by the heart passes through the large vessel into the open space or the body cavity called sinuses. हाँ, Annelida and chordata have closed circulatory system in which blood pumped by the heart is always circulated through the closed network of the blood vessel. क्या? Closed network of blood vessels. हाँ. This pattern is considered to be more advantageous as the flow of fluid can be more precisely regulated. All. हाँ, क्या लिखा? All vertebrata possess a muscular chamber heart. हाँ, all vertebrata possess a muscular chamber heart. Fish have a two-chamber heart with atrium and ventricle. Amphibians and reptile except crocodile have three-chamber heart, two atrium, one ventricle. Where the crocodile, birds and mammal possess a four-chamber heart with two atrium, two ventricle. In fish, the heart pump the deoxygenated blood. हाँ, फिश में क्या होता है? हार्ट पंप करता है deoxygenated blood which is oxygenated by the gill and supplied to the body part from the deoxygenated blood is returned to the heart. सिंगल सर्कुलेशन. हाँ, फिश में क्या होता है? सिंगल सर्कुलेशन. इन एम्फीबियंस एंड रेप्टाइल्स the left atrium receive oxygenated blood from gills, lungs and skin. And right atrium get deoxygenated blood from the other body part. However, they get mixed up to single ventricle. Mixed हो जाता है single ventricle में, which pump out mixed blood. Pump out करता है mixed blood in complete double circulation. In birds and mammals, oxygenated and deoxygenated blood received by the left and right atrium respectively on the ventricles of the same side. The ventricle pump it out without any mixing up. Two separate circulation pathways are present in these organizations. Hence, these animals have double circulation. Let us study the human circulatory system. Human circulatory system. Human circulatory system, also called the blood vascular system, consists of a muscular chamber heart, a network of closed branch blood vessels and blood. This fuel which is circulated. हार्ट द मिसोडर्मल ड्राइव ऑर्गन होता है. हार्ट क्या आता है ह्यूमन में? हार्ट ह्यूमन में क्या होता है? मिसोडर्मल ड्राइव ऑर्गन होता है. It is situated in the thoracic cavity in between the two lungs, slightly tilted to the left. हाँ, it has the size of a clenched fist. किसका? clenched fist के. It is protected by double-walled membrane bag, pericardium, enclosing the pericardium fluid. Enclosing the pericardial fluid. Our heart has four chambers, two relatively small upper chamber called atrium, atrium थोड़ा small होता है, and two large lower chamber called ventricle. A thin, कितना पतला सा, a thin muscular wall called the inter arterial septum separate the right and left atrium. Where the thick wall, the interventricular septum separate the left and right ventricle. The atrium and the ventricle of the same side are also separated by thick fibrous. कितना thick से होता है, thick fibrous tissue called the arterioventricular septum. However, each of these septa are provided with an opening through which two chambers of the same side are connected. The opening between the right atrium and right ventricle is guided by the valve formed by the three muscular flap. कितना तीन muscular flap और cups. The tricuspid valve, where the bicuspid और bicuspid को क्या बोलते हैं? mitral valve. Bicuspid valve या mitral valve guided the opening between the left atrium and left ventricle. The opening of right and left ventricle into the right होता है pulmonary artery में and left होता है aorta में, हाँ, respectively, are provided with the semilunar valve. किसमें होता है? semilunar valve. The valve in the heart allow the flow of blood only in one direction, from the atria to the ventricle and from the ventricle to the pulmonary artery or aorta. The valve prevent any backward flow. हाँ, valve क्या करता है? prevent करता है backward flow को. Okay. The entire heart is made of cardiac muscle. जितना भी heart होता है ना सब made cardiac muscle से. The wall of ventricle are much thicker than the wall of atria. हाँ, ventricle का ज़्यादा thick होता है than atria का. A specialized cardiac muscular called the nodal tissue is distributed in the heart. क्या बोला? A specialized cardiac muscular, हाँ, a specialized cardiac musculature called the nodal tissue is distributed into the heart. A patch of this tissue is present into the right upper corner of the right atrium called the senoatrial node. Another mass of this tissue is seen to the lower left corner of the right atrium close to the arterioventricular septum and called the arterioventricular node. A bundle of nodal fiber, arterioventricular bundle, AV nodal, continue from the AV and which passes through the arterioventricular septum or to emerge on the top of the interventricular septum and immediately divided into the right and left bundle. These branches give rise to the minute fibers throughout the ventricular muscular of the respective side and are called the precongic fiber. The nodal muscular has ability to generate action potential without any external stimulate. किसके पास? nodal musculature, हाँ, have ability to generate action potential without any external stimulate. It is an auto-executable होता. However, the number of action potential that could be generated in a minute vary into different part of the nodal system. Vary करता in different part of the nodal system. The SAN can generate maximum number of action potential. हाँ, SAN जो है ना, SAN generate maximum number of action potential 70 से 75 टाइम and is responsible for the initiating and maintaining the rhythm construction activity of the heart. Therefore it is called the pacemaker. इसीलिए इसको क्या बोलते हैं? pacemaker. किसको बोलते हैं? SAN को pacemaker बोलते हैं. Our heart normally beat 70 से 75 टाइम in a minute. Average 72 टाइम in minute है. अरोटा, ये क्या है? अरोटा. हाँ, ये अरोटा के नीचे क्या होता है? पल्मोनरी आर्टरी डीऑक्सीनेटेड ब्लड कैरी करता है. और इसके अंदर ये क्या होता है? ये होता है पल्मोनरी वेन और पल्मोनरी लेफ्ट एट्रियम में. ये क्या है? लेफ्ट एट्रियम. ये क्या? बंडल ऑफ हीज. क्या है? बंडल ऑफ हीज है. ये क्या लेफ्ट वेंट्रिकल, ये क्या लेफ्ट वेंट्रिकल, और ये क्या इंट्रा वेंट्रिकुलर सिस्टम, हाँ इंटर वेंट्रिकुलर सिस्टम, ये क्या एपिक्स, इसको एपिक्स बोलते हैं। ओके, राइट वेंट्रिकल है ये क्या कोर्डिया टेंडिनिया, ये क्या कोर्डिया टेंडिना, कोर्डिया टेंडिना है ये, हाँ ओके। ये क्या आर्ट्रियो वेंट्रिकुलर नोड है, आर्ट्रियो वेंट्रिकुलर नोड है, राइट एट्रियम है, ये सेनोल आर्ट्रियल नोड है, हाँ है इवेंट वेना कावा है। ओके देखो कार्डिक साइकिल, how does the heart function? Let us take a look. To begin with, all the four chambers of heart are in relaxed state. They are in joint diastole. Joint मतलब relax, diastole मतलब relax. As the tricuspid and bicuspid wall are open. Blood from the pulmonary vein and vena cava flow into the left and right ventricle, respectively throughout the left and right atrium. द सेमिल्यूमिनर वाल आर क्लोज एट दिस स्टेज, रिलैक्स स्टेज में जो होता है ना सेमिल्यूमिनर वाल जो होता है क्लोज होता है, और जो है बाइकास्पिड एंड ट्राइकास्पिड वाल ओपन होता है। द सैन नो जनरेट एन एक्शन पोटेंशियल विच स्टिमुलेट बोथ द एट्रिया टू अंडरगो द साइमल्टेनियसली कंट्रैक्शन द आर्टियोल साइस्टोल, फिर सैन जनरेट करता है एक्शन पोटेंशियल, कब, जब सब रिलैक्स स्टेट में ट्राइकास्पिड एंड बाइकास्पिड वाल खुला हुआ है, तब सैन जनरेट करता है एक्शन पोटेंशियल विच स्टिमुलेट बोथ द एट्रिया टू अंडरगो साइमल्टेनियसली कंट्रैक्शन, दोनों साथ में ही साइमल्टेनियसली कंट्रैक्शन करता है, इसको कहते हैं आर्टियल साइस्टोल, साइस्टोल मतलब कंट्रैक्शन। दिस इंक्रीज द फ्लो ऑफ ब्लड इनटू द वेंट्रिकुलर बाय अबाउट 30%, इंक्रीज कर देता फ्लो ऑफ ब्लड इनटू द वेंट्रिकल बाय अबाउट 30%. The action potential is conducted by the ventricular side by the ANV and AV nodal from the bundle of His transmitted it throughout the entire ventricular musculature. This causes ventricular muscle to contract, ventricular systole. The atria undergo relaxation, diastole, relaxation मतलब diastole, coinciding with the ventricular systole. Ventricular systole increase the ventricular pressure causing the closure of tricuspid and bicuspid wall due to the attempt of backflow of the blood into the artery. As the ventricular pressure increase further, the semilunar valve guarding the pulmonary artery right side of the and the aorta left side are forced open, allowing the blood into the ventricular to flow through these vessels into the circulatory pathway. The ventricle no relax, ventricular diastole, and the ventricular pressure fall, ventricular pressure fall कर देता है, as in closure of semilunar valve, closure का semilunar valve which prevent the backflow of the blood into the ventricle, as the ventricular pressure decline further, tricuspid and bicuspid valve are pushed open by the pressure in the artery exerted by the blood which was begin attempt empty into by the vein. The blood once again move fairly into the ventricle. The ventricle and arteria are now begin in the relaxed joint systole state as earlier. Soon SAN generate a new action potential and event described above are repeated in the sequence and the process is continue. This sequentially event in the heart which is cyclic repeated is called the cardiac cycle and consists of systole diastole of both the artery and ventricle. As mentioned earlier, the heart beat 72 times per minute. There may be cardiac cycle are performed per minute. From this could be decided that duration of circulatory duration of cardiac cycle is 0.8 second. Cardiac cycle duration is 0.8 second. During a cardiac cycle, each ventricle pump out approximately 70 ml of blood, which is called the stroke volume. During cardiac cycle, each ventricle pump out approximately 70 ml of blood, which is called the stroke volume. एक 70 ml कर दे, दोनों कितना करेगा 140 ml. The stroke volume is multiplied by the heart number या number of beat per minute give the cardiac output. Therefore, the cardiac output can be defined by the volume of blood pumped out by each ventricle per minute, average 5000 ml to 5 liter in a healthy individual. The body has ability to alter the stroke volume as well as the heartbeat and thereby the cardiac output. हाँ, the body has ability to alter the stroke volume as well as the heart rate and thereby the cardiac output. इसलिए cardiac output. For example, the cardiac output of an athlete will be much higher than the ordinary man. During each cardiac cycle, two prominent sounds are produced can easily by the heart through the stethoscope. The first heart sound love is associated with the closure of tricuspid and bicuspid wall. जब साउंड को लव तभी क्लोजर होता है ट्राइकास्पिड एंड बाइकास्पिड. Whereas the second heart sound dhav is associated with the closure of semilunar valve. These sounds are clinical diagnostic significant. Electrocardiograph ECG. Electrocardiograph. You are probably familiar with this scene from a typical hospital television and so a patient is hooked up by monitor machine that show the voltage trace. क्या होता है? voltage trace होता है on the screen and make the sound pip 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 p as the patient go into the cardiac arrest. This type of machine electrocardiograph machine को क्या बोलते हैं? electrocardiograph is used to obtain electrocardiogram. हाँ, यूज टू अपने इलेक्ट्रोकार्डियोग्राम ECG. हाँ, मशीन को बोलते हैं इलेक्ट्रोकार्डियोग्राफ और जो उसमें ग्राफ ऑप्टेन होता है उसको बोलते हैं इलेक्ट्रोकार्डियोग्राम. हाँ, ECG इज अ ग्राफिकल रिप्रेजेंटेशन ऑफ द इलेक्ट्रिकल एक्टिविटी ऑफ द हार्ट ड्यूरिंग द कार्डिक साइकिल. टू ऑप्टेन स्टैंडर्ड ECG एज शोन इन द फिगर, ए पेशेंट इज कनेक्टेड विद द मशीन विथ कितना? तीन इलेक्ट्रिकल लोड्स, वन टू ईच wrist दोनों में एंड टू लेफ्ट एंकल और टू लेफ्ट एंकल. लेफ्ट एंकल में क्यों वहाँ पे ऑक्सीजनेटेड ब्लड फ्लो होता है इसलिए. दैट कंटिन्यूसली मॉनिटर टू द हार्ट एक्टिविटी. फॉर अ डिटेल एवोल्यूशन ऑफ द हार्ट फंक्शन मल्टीपल लीड अटैच टू द क्लोज चेस्ट रीजन. हाँ, डिटेल स्टडी के लिए मल्टीपल लीड अटैच करना पड़ता है चेस्ट रीजन. हेयर वी विल टॉक ओनली अबाउट स्टैंडर्ड ECG. Each peak in ECG is identified with a letter from P and T to corresponding to a specific electrical activity of the heart. The P wave represents the electrical excitation or depolarization of the atrium. P wave represents electrical excitation or depolarization of the atria, which is concentration of both the artery. The QRS complex represents depolarization of the ventricles, which initiated with the ventricle contraction. The contraction starts shortly after Q. Contraction start होता है shortly after Q and mark the beginning of the systole. Mark क्या? beginning of the systole का. The T wave represent return of the ventricle from the excited to normal state, repolarization. The end of T wave which marks the end of systole. Obviously, by counting the number of QRS complex that occur in a given time period, one can determine the heartbeat rate of an individual. Since ECG obtained from different individuals have roughly the same shape given lead configuration, any deviation from this shape is indicated a possible abnormality or disease. Hence, it is great clinical significance. Yes, ये बोथ आर्टरी का डीपोलराइजेशन है. ये क्या है? बोथ वेंट्रिकल का है और ये क्या? रिलैक्स स्टेट में आने का है. Double circulation. The blood flows strictly a fixed route through blood vessels, the artery and vein. Basically, each artery and vein consist of 3 layers. Each artery, हर एक artery and vein, each artery and vein consist of 3 layers. And inner lining of क्या होता है? Squamous endothelium. Inner lining क्या होता है? Squamous endothelium. The tunica intica. A middle layer of smooth muscle cell and elastic fiber. tunica media and the external layer of fibrous connective tissue with collagen fiber. The tunica externa. Tunica medica is comparatively thin. टूनिका मीडिया जो मिडिल वाला होता है वो कंपेरेटिवली थिन होता है इन द वेन, किसमें, वेन में. As mentioned earlier, the blood pumped by the right ventricle enter into the pulmonary artery, where the left ventricle pump blood into the aorta. The deoxygenated blood pumped into the pulmonary artery. It passes onto the lung, where the oxygenated blood is carried by the pulmonary vein into the left atrium. This pathway consists of the pulmonary circulation. The oxygenated blood enters the aorta is carried by the network of arteries and aortals and capillaries to the tissue. From the deoxygenated blood is collected by the system of venicles. Deoxygenated blood is collected by the system of venicles, vein and vena cava, and emptied to the right atrium. This is the systematic circulation. Systematic circulation provide nutrition, O2 and other essential substance to the tissue and take CO2 and other harmful substance away from the elimination. Systematic circulation provide the nutrition, O2 and other essential substance to the tissue and take CO2 and other harmful substance away from elimination. A unique vascular connection exists between the digestive tract and liver. हेप्टिक प्रोटियल कुछ नाम होता है इसका शायद, कॉल्ड द हेप्टिक प्रोटियल सिस्टम. हाँ बोले ना. एंड द हेप्टिक प्रोटियल वेन कैरिड ब्लड फ्रॉम द इंटेस्टाइन to the liver before it delivered to the systematic circulation. A specialized coronary system of blood vessels is present in our exclusively for the circulation of blood to and from the musculature. हाँ देखो क्या लंग्स, क्या लंग्स से आया ब्लड. पल्मोनरी वेन में क्या होता है, ऑक्सीनेटेड ब्लड. हाँ ऑक्सीनेटेड ब्लड लेफ्ट एट्रियम में आया, लेफ्ट एट्रियम डोर्सल अरोटा से गया, हाँ बॉडी पार्ट में गया, फिर बॉडी पार्ट से ब्लड आया. हाँ फिर यहाँ वेना कावा में गया, ग्रेट वेन होता है. वेना कावा क्या होता है, ग्रेट वेन. फिर राइट एट्रियम में, फिर राइट पल्मोनरी आर्टरी से लंग से बाहर. ओके ये कैपिलरीज है, क्या ल्यूमन अंदर में जो जगह होता है उसको ल्यूमन बोलते हैं. आर्टरीज का है ना, ये आर्टरीज का अंदर का जगह ल्यूमन और स्मूथ मसल सेल होता है. इसमें क्या होता है, ल्यूमन एंड स्मूथ मसल सेल होता है. ओके रेगुलेशन ऑफ कार्डिक एक्टिविटी. नॉर्मल एक्टिविटी ऑफ हार्ट आर रेगुलेटेड इंटरसेसली. हाँ नॉर्मल एक्टिविटी जो होता है ना हार्ट का एक्टिवेट रेगुलेट इंटरसेसली. ऑटो रेगुलेटेड बाय स्पेशल मस्कुलर. हाँ ऑटो रेगुलेटेड बाय स्पेशलाइज्ड मसल नोडल टिश्यू. हैंस द हार्ट इज कॉल्ड द मेसोजेनिक. A specialized neural center in the medulla oblongata can moderate the cardiac function throughout the autonomous nervous system ANS. Neural signal through the sympathetic nerve part of ANS can increase the rate of heartbeat, the strength of pulmonary contraction, and thereby the cardiac output. Once, on the other hand, parasympathetic neural signal अनदर कंपोनेंट ऑफ एनएस. हाँ क्या है पारासिम्पैथिक जो होता है ना, पारासिम्पैथिक न्यूरल सिस्टम अनदर कंपोनेंट है किसका, एएनएस का. हाँ एएनएस का. हाँ डिक्रीज द रेट ऑफ हार्ट बीट. हाँ पारासिम्पैथिक न्यूरल सिग्नल जो है अनदर कंपोनेंट ऑफ एएनएस का, जो कि डिक्रीज कर देता रेट ऑफ हार्ट बीट. हाँ स्पीड ऑफ कंडक्शन एक्शन ऑफ द पोटेंशियल एंड देयर बाय कार्डिक आउटपुट. हाँ इसके लिए कार्डिक आउटपुट को भी कम कर देता है. हाँ एडर्नल मेडुला हार्मोन can also increase the cardiac output. Adrenal medular hormone. Adrenal medular hormone can also increase the cardiac output. Disorder of circulatory system. High blood pressure, hypertension. High blood pressure को बोलते हैं hypertension. Hypertension is term for blood pressure that is higher than normal. हाँ 120/80 नॉर्मल है, इससे ज़्यादा होगा तब हाइपरटेंशन बोलते हैं. इन दिस मेजरमेंट 120 मिलीमीटर ऑफ मर्करी प्रेशर. मिलीमीटर ऑफ मर्करी प्रेशर इज द साइस्टोल और पंपिंग प्रेशर. साइस्टोल और पंपिंग प्रेशर. साइस्टोल होता है मतलब कॉन्ट्रैक्शन और द पंपिंग प्रेशर होता है. 80 mmHg इज अ डायस्टोल रिलैक्स करना होता है. और रेस्टिंग और प्रेशर इफ रिपीटेड चेक ऑफ ब्लड प्रेशर ऑफ इंडिविजुअल. 140/19 or higher, it shows the hypertension. Blood pressure lead to the heart disease and also affect the vital organ like brain and kidney. हाँ. Coronary artery disease (CAD). Coronary artery disease called the CAD. Coronary artery disease often referred to as atherosclerosis. Atherosclerosis affect the vessel that supply blood to the heart muscle. It is caused by deposit of calcium, fat, cholesterol, and the fibrous tissue, which make the lumen arteries narrows. क्या करता है? ल्यूमन आर्टरीज को नैरो पतला बना देता है. एजीनिया. It is called the agenia pectoris. A system of the acute chest pain appear when no enough oxygen is reaching to the heart muscle. Agenia can occur in men and women of any age, but is more common among the middle age and elder. It occurs due to the condition that affect the blood flow. Heart failure. Heart failure means the state of heart when not pumping blood effectively enough to meet the need of body. It is sometimes called a congestive heart failure. Congestive heart failure because congestion of the lung is one of the main symptoms of this disease. हाँ. Heart failure is not as the same as cardiac arrest. Cardiac arrest when heart stop beating, or the heart attack when the heart muscle is suddenly damaged and inadequate blood flow. Summary. Vertebrata circulated blood, a fluid connective tissue in their body to transport essential substance to the cell and carry waste substance from another fluid. Lamp fluid is used to transport of certain substance. Blood comprised of fluid matrix, plasma and form element. Blood comprises the fluid matrix. Blood composes the fluid matrix, plasma and form element. Fluid matrix, plasma and form element. Red blood cell (RBC), erythrocyte. White blood cell (leukocyte), WC. Platelet, thrombocyte constituent the form element. Constituent क्या कहता है? Form element. Blood of the human are group A, B, AB and O system based on the presence or absence of the surface antigen. A, B on the RBC. Another blood group is done on the basis of presence of or absence of another antigen called the rhesus factor RH on the surface of RBC. The space between the cell in this tissue condition filled derived from cause of the blood and called the tissue filled. हाँ. The space between the cell in the tissue contain a fluid derived from the blood called the tissue fluid. Okay. This fluid called the lymph is almost similar to the blood except for the protein contained the form element. All vertebrata and few invertebrata have closed circulatory system. All vertebrata के पास and few invertebrata have closed circulatory system. Our circulatory system consists of muscular pumping organ, heart, network of vessel and the fluid blood. Heart have two artery, two ventricular. कार्डिक मस्कुलर क्या होता है? ऑटो एक्साइटेबल होता है. सिंस आर्टियल नोड SN जनरेट द मैक्सिमम नंबर ऑफ एक्शन पोटेंशियल पर मिनट 70 से 75 and therefore it set passage of activity of heart activity. Hence it is called the pacemaker. The action potential causes the artery and the ventricular to undergo contraction systole followed by the relaxation diastole. The systole force the blood to move from the artery to the ventricle and the pulmonary artery and the aorta. The cardiac cycle is formed by subsequently event in the heart which is cyclic repeated and it's called the cardiac cycle. A healthy person shows 72 cycles per minute. About 70 ml of blood pump out of each ventricle during a cardiac cycle and it's called stroke or beat volume. Stroke or beat volume. Volume of the blood pump out by each ventricle per minute called the cardiac output and is equal to the product of a stroke volume and birth number. Approximately 5 liter. Electrical activity of the heart can be recorded from the surface using the electrocardiogram graph and the recording is called the electrocardiogram. इलेक्ट्रोकार्डियोग्राफ मशीन का बोलते हैं, इलेक्ट्रोकार्डियोग्राम उसका रिप्रेजेंटेशन रिकॉर्डिंग को बोलते हैं। विच इज ऑफ क्लिनिकल इंपॉर्टेंस, वी हैव we have complete double circulation, two circulation pathway namely pulmonary and sympathetic are present. The pulmonary circulation starts by the pumping of oxygenated blood from right ventricle, which is carried by the lungs, where the oxygenated is returned to the left atrium. This system is circulation start with the pumping of oxygenated blood by the left ventricle to the aorta, which is carried all the body tissue, and deoxygenated blood from there is collected by the vein and returned to the right atrium. Thought the heart is auto-excitable. Heart क्या? Thought that heart is auto-excitable. Its function can be moderated by the neural and the hormonal. हाँ, heart auto-excitable heart होता है. Its function can be moderated. Function क्या होता है? Moderated करते हैं by neural and hormonal mechanism. और ये चैप्टर completed. हाँ. स्नोफिल क्या करता है? स्नोफिल रेसिस्ट इन्फेक्शन. आरबीसी क्या है? आरबीसी क्या है? आरबीसी गैस ट्रांसपोर्ट में मदद करता है. एबीओ क्या? एबीओ यूनिवर्सल रिसेप्टेंट है. प्लेटलेट क्या करता है? कैजुकुलेशन में मदद करता है. और साइस्टोल का कंस्ट्रक्शन ऑफ हार्ट. चैप्टर कंप्लीटेड.